Head injury. Head injury, also known as traumatic brain injury, TBI, traumatic brain injury, is the disruption of normal brain function due to trauma-related injury resulting in compromised neurologic function, resulting in focal or diffuse symptoms. TBI, that is traumatic brain injury, is classified as mild. GCS will be 13 to 15 with loss of consciousness to 15 minutes. Moderate is GCS will be 9 to 12 with loss of consciousness for up to 6 hours. And severe TBI, traumatic brain injury, GCS will be 3 to 8 with loss of consciousness greater than 6 hours. Studies have shown that mild TBI with this positive CT scan is more indicative of moderate injury, resulting in more pronounced neurobehavioral presentation and extended neurologic recovery time frame beyond the typical 3 months. Pathophysiology and etiology. Types of brain injuries include concussion, cerebral contusion, brainstem contusion, epidural hematoma, subdural hematoma, and skull fracture. Concussion, cerebral contusion, brainstem contusion, epidural hematoma, subdural hematoma, and skull fracture. Caused by blunt or penetrating injury, neurologic deficits result from shearing of white matter, ischemia and mass effect of the hemorrhage, and cerebral edema of surrounding brain tissue. Clinical manifestation: disturbances in consciousness, confusion to coma, headache, vertigo, agitation, restlessness, respiratory irregularities, cognitive deficits, pupillary abnormalities, sudden onset of neurologic deficit, coma and coma syndromes, persistent vegetative state. Diagnostic evaluation: CT scan to identify and localize lesions, edema, bleeding. Second one, skull and cervical spine films to identify fracture, displacement. Neuropsychological test during rehabilitation. Phase 2 determine cognitive deficits. Management of increased ICP, antibiotics to prevent infection with open skull fractures or penetrating wounds. Surgery for evacuation of intracranial hematomas, debridement of penetrating wounds, elevation of skull fractures, or repair of CSF leaks. Complications: infections, systemic, respiratory and urinary, neurologic meningitis and ventriculitis. Increased ICP, hydrocephalus, post-traumatic seizure disorder, permanent neurologic deficits, cognitive, motor, sensory and speech. Neurobehavioral alterations, impulsivity, uninhibited aggression, emotional lability. Nursing interventions must include maintaining adequate cerebral perfusion, maintain patent airway, monitor ICP, monitor for changes in neurologic status, decreased level of consciousness LOC and onset of cranial nerve deficits, and maintaining respiration, meeting the nutritional needs, promoting cognitive function, preventing injury and strengthening family coping. Thank you.